It is the unknown, and a lot of us have questions. And separating facts from fiction surrounding this pandemic is why we are continuing this portion of the show where we bring viewer questions about COVID-19 to some of our local experts. And tonight we're once again speaking with Dr. Robert A. Frolichstein, an emergency room doctor working right here in San Antonio at Methodist Hospital. Doctor, as always, thank you for joining us. What are you seeing in the emergency room lately?
So the last week has been pretty encouraging. We're still seeing a few cases, new cases being admitted, but we're seeing much more patients recover, many more patients recover and be discharged home. So the overall number of patients with COVID in Methodist Hospital right now is very low. It's at only 15 patients. And I just want to make sure everyone understands those patients are in a separate area of the hospital, and they're cared for by a separate team of nurses and techs and doctors that don't move from patient to patient. So you're safe coming into the emergency department.
And that's what I want to expand on that a little bit, because since we really first started talking, you were concerned that you're not seeing some of the normal cases, the non-COVID related cases that you usually see in the ER.
That's very true, and it's concerning. And just as an example, we're a comprehensive stroke center. That means we have many treatments available for strokes. One of those treatments is a medication to possibly dissolve a clot that is causing a stroke. In a normal month, we would administer that medication between 10 and 15 times. In all of April, we only administered it 5 times. And what I'm fearful of is that's 5 to 10 patients who sat at home, came in too late in order to get that medication that might improve their outcome. So.
And that's why it's so important to get the message out there that the ER and the hospitals are safe.
Correct.
Yeah.
Correct.
All right. First question we have tonight: what are some of the new symptoms of COVID-19 that have been spelled out?
Yeah, so I think the CDC added some symptoms for people to look at, and most of them are really just those symptoms that we would normally associate with any viral illness: headache, sore throat, chills, recurrent chills. And those are pretty common. Sore throat are pretty common with really any viral illness. And I want to remind people that it's not just one of those; it's a combination of those, and they have to kind of present in the correct way to be worrisome for COVID. If you just have a headache, that's not really very worrisome for COVID without some of the other symptoms. Kind of one of the interesting symptoms that they added, which does seem to be fairly unique to COVID, is this loss of taste or smell. And I haven't personally seen any patients with it, but I know my colleagues have, and it's a pretty profound symptom. So it's not a subtle thing, so don't get worried if you just feel like your food tastes a little funny.
Yeah, you're going to know it. Yeah.
Yes.
Is there any evidence, the next question from our viewers, is there any evidence that COVID-19 can be transmitted by secondhand cigarette or marijuana smoke?
No, that really, certainly there's no evidence of it. It doesn't even make any sense by the way we know the disease transmitted, unless you're sharing that cigarette or with someone else. Then of course there would be that risk of transmission.
There's been a lot of talk at the orders that have come from the city and the county not necessarily matching up with the reopen orders that are coming from the governor. Do you think it's too soon to open San Antonio?
Well, that's a very complicated question. From a purely clinical perspective, we don't want to open up until the virus is all the way eliminated. But that's really not feasible. That's like saying that, there's 6,000 deaths on the highway every year in Texas because of motor vehicle crashes. Let's not drive cars. That's just not realistic. And so what we have to do is to put safety practices in place that are akin to a seatbelt on a car to make it as safe as possible. And I know those steps are occurring. I know some of the criteria to reopen are very close to being present. I'm not sure they're totally present yet. For instance, the decrease in number of cases, I think we want it to be consistently decreased for 2 weeks. I don't think we're quite there yet. We certainly have the hospital capacity now. And I know testing and the ability to trace people is definitely ramping up. So I think think we're pretty close from the clinical standpoint. There's a whole host of other factors that go into it that we have to trust our leaders to do the right thing.
Absolutely. All right, next question. I'm noticing a lot of people wearing masks on either their mouth or their nose, but not always both. Do both have to be covered to work?
Yeah, you really need to cover both. The idea behind a mask is to prevent spreading of droplets of saliva, and those droplets can come from your nose or your mouth. So really, yes, they both need to be covered.
How many tests is your ER performing daily? I know you don't know all of them, but let's say in a normal shift for you and your colleagues, how many COVID-19 tests are you usually performing?
So currently, we are still really only testing people that we are suspicious might have the disease and need to be admitted to the hospital or are going to undergo a procedure or an operation. And still that probably leads maybe to a dozen tests per day per facility.
Do you anticipate there'll be some changes in visitation or some ways that the hospital operates now that the reopening of Texas will begin tomorrow?
I do think there'll be some changes. I know that some of those have already occurred with the reopening of some surgical cases. I know many of those patients are allowed to have a visitor during that surgery. And I know are discussions amongst hospital leadership about opening up at least to have one visitor per patient. That's not yet occurred yet. They're planning on it.
I like to do this with a lot of our experts, and I want to give you the final word. What do you think our viewers need to know tonight?
I think that I want to thank the community for all their efforts. This has not been nearly as bad as we had hoped or that we anticipated. And what we hope is that there won't be a bigger second wave coming. And so the way to make that happen is continue to be prudent, even after things open up. That doesn't mean things are back to normal. We're still going to need to take the precautions that we've all learned over the last many weeks.
Dr. Robert Frolichstein, as always, I appreciate your time.
Thank you.
We'll be right back.